Hello, everybody. Thanks for stopping by for this great conversation. My name is Richard Louie. It's really great to be here, to have you here for what I find was a very important, compelling documentary short with a familiar face or two, the filmmakers of the new short documentary Pandemic19. Please welcome the husband and wife team. I don't get to say that very often when it comes to filmmaking. Chang, as well as Katsura Rollins. They both directed Pandemic19 together. And I think they do know how to, here they are, ladies and gentlemen. Okay.
Just push the button, but yeah, there we are. Here we are.
Hello.
Hi there, Richard.
Both of you. Yeah. So first off, when you think of Pandemic19 today versus when you started the concept, there's obviously been a long arc of why you did it and what it means. But take us back to when you got the idea and how many hot dogs and chips and salsa you were eating at that time.
I'll let her take this one.
It really feels like so many years ago that it was ever before a pandemic hit us here in North America. Yeah. But it was I think late February or early March 2020, and
it was February.
Yeah. And we were just so naive. We'd heard, of course, there was a COVID-19 and come out of Wuhan.
Where were you again? Where were you?
We're in Toronto at this time.
We are in Toronto currently. Yeah.
Okay.
She's American. I'm
sorry to hear about that. Yeah.
And we just heard that it had started spreading in Italy. The virus had landed in Italy, but we just somehow never ever thought of the possibility of it coming to North America and what it might do to our everyday lives. But I have a best friend in Minneapolis, in the US, who's an anesthesiologist, Dr. Allison Rudy. And she has always been my sort of canary in the coal mine regarding, something of this nature. She can really understand the science. And she was tracking everything. And she was calling me with such an internal panic. I could hear it in her early on. And then while she was sort of, letting me know how bad it was going to be before, of course, everyone else did. She also said to me, because she knew that when the pandemic hit, she would be isolated because she was going to be at the hospital. And when she came home, she didn't want to expose friends and family. And so she said very plainly, I think this is going to be a really trying time for me and the healthcare professionals I work with. How might I best record a video diary so that I can sort of remember what this time was like and save it for myself to look back on it. And that was the impetus for me to say, wait a second, I would think that not only do many doctors probably want to share this unique story and side of the story, but actually that those of us who are civilians are really, really need to hear that story, because we were in the opposite reality, which is isolated and totally distant from this very real threat.
And so then what was that conversation like that the two of you had?
Well, so here I am. I just finished my feature documentary. It was just started touring, the one about the journalist Robert Fisk. This is not a movie. And I just flown back from Los Angeles from a screening in LA, like literally in I think like just early March. Mm-hmm. And I was very much in denial, like hearing the reports. I have a brother who lives in Beijing, and he was in lockdown since December, and they were going through everything.
I was terrible.
In this denial where it was like, that's in China. They contained it. It's not coming over here. This is just a SARS situation, because in fact I was in Guangzhou at the time SARS broke, and I came back to Canada and quarantined for 7 days back in 2002 or whatever it was. Anyway, so I was in denial, but I was also kind of in a funk because it was becoming a reality that I wouldn't be able to travel with this new film of mine, and that I guess then the kind of link up was like.
Yeah, it was.
And he was like, "We got to do this." And I was like,
"Yeah."
And I think as a documentary filmmaker, Young can sense when something is a story that we're going to want to be witness to, and so he was like, "Yeah, let's do that." let's capture this, let's capture what we thought was more of a time capsule, but now we see has been relevant for a longer period than we thought.
And the task, well, the beginning, the task seemed daunting, just to figure out who could populate the film, who would be the voices of this film,
how would we do that,
and what is the approach, and is it going to be? But I think very quickly we determined that it was going to be through the voices of the doctors, through these video diaries, that we wouldn't editorialize too much that process of them recording these video diaries, and that we wanted to make sure that it was. That it wouldn't be the headline kind of ripped from the headline story that we were telling, that it would be much more, a little slow burn in that way.
So is this the first time the two of you have collaborated? And if not, how is this one different? Other than your daughter,
that project aside,
it's an ongoing collaboration. What's funny is before the pandemic, Young and I have been
we vowed never to work together.
We have vowed never to work together.
We know what that's like, and we
both have very strong creative personalities and sensibilities, and we knew that it might put a strain on our relationship, but like the pandemic has brought to everybody, you make different choices because you're given some pretty exquisite parameters. And as soon as COVID hit and we were stuck in this house, but as artists and storytellers, of course, the impulse is even stronger to tell a story and to find stories to tell, that we were just here together. And we thought, well, okay, I guess it's time.
We were sort of like, there's no other. I mean, this could be our reality for the next while, and it has been.
We've been collaborating so much more this year.
So the two of you are like, we're already in the house together with our daughter. Why not add a little bit more tinder into the fire, and let's start a project together?
Richard, we were very aware of it.
2020 fun. Let's make this a fun year.
I'm joking. I'm joking.
A party year. A year of partying.
This was. And it was intense. Like, obviously, you've seen the film. The content is quite heavy. It was. I would literally come down, and I was also working on another new project remotely. So I was working full time on that project. I come downstairs, and Annie's processing the videos that are being sent to us, and she'd be weeping from one of those very emotional snippets from Dr. Brady, for example, the doctor in Boston. And it was just like, it was heavy times, man. That first surge, March to July, that was heavy times, and I think we were all feeling the density of that situation, which is like feeling the apocalypse around the corner, and I still think it still kind of feels like that after all these months.
But I have to say, go ahead.
Go ahead, Annie.
Well, I just wanted to say that as heavy as it was, how grateful we were to actually have something to work on that was relevant to that moment. Nothing grounded me more than receiving those video diaries. Nothing. I think it's actually harder to be floating into this new, really strange reality of being isolated, which I just have never considered this a possibility. And to have their stories come in every night just made me so aware of exactly what we were fighting against, and also to put my struggles, quote unquote, in total relativity. The perspective was very clear, so it didn't feel it was actually, I was really glad to have it, honestly, and I wish we still had it. I wish they were still sending us diaries.
I mean, you put it into Annie would beautiful. Say you would say it in context, like, you maybe want to say it, because I'm just going to say it.
I don't know what you're saying.
Well, she had written about how the fact that while we were worrying about how to go buy groceries and like wash down things, back in the early days, how to save toilet paper. Meanwhile, these frontline doctors, and one of them being my cousin, are fighting the virus head on. So sobering reality.
I must admit, in watching your other interviews together, ladies and gentlemen, they're even more funny and more together. So I was joking about all that other stuff just because
it gets better, right? We get better.
Just because we can. In other words, I joke. There's no a subtext to this where I saw something, but no, I was watching other interviews, and the two of you are truly a dynamic duo. A lot of people, I'm sure, have said that. One of the things about seeing the doctors express their stuff is, throughout the pandemic and in my dealings with hospitals over the last 5 years, because of my father, they don't generally do this. And as we have seen it expressed over the pandemic, this has given, I think, a heart to a part of our workforce, our healthcare workforce. We knew was there because they show up every day. But then in Pandemic19, you really selected those parts that they may not be crying, but they're crying.
Yeah. I mean, I think that, yeah. I mean, I think the point around that is we were getting the sense, intaking a lot of information 24/7, the coverage in the media, and getting a sense of, people were trying to figure things out as they were going along, and nobody really knew what the virus was, right? And we were still trying to figure it out, but we weren't getting the sense of that emotional side of the deep emotional contemplative side of it, which, as we know, doctors to be and can be very thoughtful, and that's what we wanted to tap into.
And I also think that doctors are so trained to compartmentalize, when
they have to,
up,
kind of, right?
They have to, yes. I think for survival, absolutely. But also so that when they're in the hospital dealing with patients, there's one side that they present. And then of course, when they're home in close company, they might show a different side. But I feel like the pressures of a global pandemic also gave a little allowance to them to open up even more, because it was just too much to hold. And I think it was dangerous for them. As we've talked about, of course, the mental health crisis, not just for healthcare professionals, but for everyone, is the sort of second invisible pandemic happening right now. And yeah, we lucked out with some doctors who were willing to share, but I think many probably needed to share, and hopefully, everyone had someone they could share with that maybe wasn't a video diary, but they had someone to share with this time.
Yeah.
And this is different for the two of you because, you're not there. I know for me, at least I can talk to somebody through a camera, or I'm in the field. The two of you were neither of those two, and you had to, how are you communicating with them, I guess, if it wasn't that way? Yeah. And how strange was that as filmmakers?
Well, for me, totally strange. Yeah. I'm used to being in the field. I'm used to being on the ground. I usually feel like I need that intimacy, that contact, and that relationship building, which is so essential to the process. In regards to this film, the approach was unique in that, we weren't directing, really. We had reached out to a handful of doctors through our contacts. And again, my cousin, Brian Chang, is one of the doctors in the film, who I had more immediate contact with, and could kind of persuade him to be more involved.
Persuade.
With, getting into the filming of himself, which he is not. Yeah, he's actually very unassuming, shy guy. He doesn't like to be in front of the camera.
I think he'd never taken a selfie before we asked him to do it.
I really had to twist his arm. And he did it for us, particularly. But the candor, the kind of part of it, getting them to open up, was not intent. We didn't push that, and I think occasionally, so basically there was no interface with any of the characters. Even Brian was pretty removed because he is a pretty shy guy. It was hard to get him on the phone, so
he didn't come across that way, I must say, in the film.
No, he doesn't. I think there was a little bit of give us a little, I think the guidelines we set for the doctors was very important, right? We sent out this initial kind of, here's what we'd love, and just let the recording roll on your cameras. The biggest thing we had to deal with was just technically, the doctors don't know how to film. They don't know cameras. They don't understand. So there was always a little adjustment, technically speaking, but other than that, it was very subtle.
And
which is so weird for me.
But I think it was, again, an initial compromise. It felt like a compromise initially, we can't be there, so this is what we have to do. But actually,
that restriction helped.
The restriction feels also true to the pandemic. Had we been there, it might have felt strange, or something again about this distant, otherworldly diary to kind of no one but everyone felt right too. And what was interesting is that once we relinquished that control, And we just said, I interfaced a lot through email, but there was no direction. Maybe there was like, can you clarify this question for me? Or can you tell me what it felt like when this happened? There was a few questions that I said, you don't have to answer if you don't want to, no problem. So receiving what we received was in some ways like the least mediated sort of outpouring from these doctors. And I think you can kind of feel that it's just them literally putting down what they felt that day.
And the other thing that's so intentional with the film, though, is the device of having the doctors be only in these screens, more or less, as the confessional window, right, in this frame here. And then we intentionally left it so that any of those, what we've been calling interstitials between those diaries, which essentially is B-roll, but B-roll that was very, very particular. I mean, we were looking with our cinematographer in New York, Derek Howard, we were looking for footage that was, kind of empty, devoid of any humans, kind of just these quiet, eerie frames and stills. And then he would catch the cinematographer would catch these crazy shots, like the rabbit running through the garbage in New York, and then so we worked on just keeping it empty, which mostly the film is. And meanwhile, the intention was that there was the acknowledgement that there was chaos happening outside of these frames of the doctor's confessions. And then we did a little pickup shooting with a couple of the doctors, Dr. Brady and Dr. Chang, just to, kind of build that bridge, that link that they are intersecting with that eerie landscape a little bit. Does that make sense? And then in the end, I think, we wanted it to, that kind of approach, I think, fills the context, the void of that world that they're existing in, that we are existing in the movie.
Yes, that is. It definitely read that way. It was sort of the quiet shadowing of what they were living through.
That's a good way to say it, yeah.
I'm around a million people, but I'm around nobody.
That's it.
That which is that crash of humanity. Speaking of humanity, what did you learn from those three characters about humanity as you were doing this? And what did you select to show the world about humanity from who they are?
Such a good question.
That's a huge question. That's so good.
That's a Richard question. That's so good. That's so good.
I mean,
not really.
I mean, I'll just say this. So this is just from the gut because I haven't thought about this. But I think honestly, they showed me what I hoped. What I always hope is there in humans. This unprecedented global crisis that we're all in. Never before have we all been in the same crisis at the same time. And it can go either way. It does go either way, depending on how you're feeling in the day or what you're witnessing, which country you're in, right? Some of it's really dark and really tough, and some of it is so good. And some silver linings really pop up there. And to me, when I hear, again, that personal sacrifice, but what's more interesting actually is that all of them, nobody ever talked about sacrifice. They would all say like, yeah, people are calling us heroes, but it's my job. This is what I signed up for. This is why I was called to medicine initially. And it makes me feel useful. I feel, all of those things, again, just it reinforced and reaffirmed my belief in humanity as it's a human project. it's a human thing we're all facing. So I mean, one of the other intentions of this film, and we strategically decided that we wanted to get it out and release it before the past election, and there was an intention there, because I think when I look back at the humanity in the film and the question of what it left me with was a kind of anger, and looking at the sacrifice these doctors were putting forward without the infrastructure, without the support of federal government, and they were just sort of operating on their own terms, trying to figure this out, just fighting their way through it, relying on the bolstering of the community. Often Dr. Brady talks about that one particular time she had never felt since 9/11, where it was medical frontline workers just like arm in arm,
and they were fighting something, and nobody else was there to kind of like usher them through a little. It was just them alone in that way. And that to me was, it's angering. It's an it makes me step back and see how much was at risk and at stake through these doctors, And then when you break it down, each character does sort of represent something. So, Dr. Brady is the core, the emotional core, I think, really, really open in giving a lot of those conflicts, those moral conflicts she faces as a ICU doctor. And then you have my cousin, Dr. Chang, who is, in my opinion, kind of the adventurous person who is kind of into it in the beginning to seek, it was sort of like
fascinating
a fascination for him to see and witness the virus. And then later, of course, you see this turn in his character where it really hits home for him.
Yeah, sobering.
The sobering moment. And then for Dr. Isola, which is just completely shocking, and I think also a slightly, social commentary on the American health system, is just the fact that she was fired. An emergency physician fired or furloughed or let go from her job. And that's shocking that that's happening with the private healthcare system in America.
Yeah.
So, what do you think was the quality in each of your characters that had them move through this heroic arc in their life, during the pandemic, that they themselves were coming to grips with, that they actually had signed up for it when they said the Hippocratic Oath out loud? They wanted to be this. They really are that. But in the end, the quality that came through in the interviews or their testimonials, you're able to look through that. What was that quality, you think, for each one of them that got them through the gray space of that reality? I guess I am what I wanted to be, and now it's here, but it is a horrible, horrible situation that maybe I'd rather not happen to actually be in this situation.
Yeah.
I don't know what that is. What is that? Grit or?
Well, let's be honest. I mean, we know for a fact that there were doctors out there who just didn't want to be a part of this, and they stepped away and they stepped back.
There weren't many, but there were some.
Sorry, I don't mean to. Yeah, I'm not trying to.
There were some. Yeah, there were some.
That's a good catch. Thank you for that. But you know what I mean. Like, I think there is a quality that defines many in the medical profession, not only frontline doctors, but we're talking about nurses and wherever you want to go down that list. Even definitely the caregivers and all those people that put a lot on the line to take care of someone. Yeah. I get emotional thinking about. I'm just going to get emotional thinking about this. But my father is a doctor, physician, recently retired. And I remember growing up as a kid, just knowing that he wasn't at home at 3 a.m. or getting up to go to the hospital because he got called in to help somebody. And I remember he was a kind of an old country doctor, and he would go door to door, and my brother and I'd be waiting for him as he went to go spend what seems like an hour with his patient. And he would tell my brother and I to honk the horn after a certain time had hit so that he would come out eventually. But he's the guy with the black bag and he would go around, and I think,
how cool is that?
Yeah, I think there is something about that sacrifice doctors make. And I think it's one of those professions that requires that oath, and they take it, and it's kind of drilled into them. Yeah. As all the training they go through. And I think a lot of doctors seek that moment when they have to, even Dr. Rudy, your friend, wants that moment where they have to just put their life in front of, and sacrifice.
Yeah.
Does that make sense?
If I can quote Dr. Alison Rudy, I feel like, she actually didn't see many COVID patients because of where the hospital was located and whatnot. And she was, in a funny way, disappointed. She says that, because most of her practice is elective surgeries. And that's actually, she's like, I'm so happy to make people feel comfortable and get through surgery safely. But actually what she signed up initially to do was this greater good project, which is, they're professional caregivers, really, just, in a very specific way. And I think that those who are called to medicine and healthcare, including the lab techs and the people who clean the hospital and the nurses and everyone, those who are called there for that reason, this is a moment for them that, again, you can feel that like capital U usefulness to the world. And then those, I guess, who are just in it for money, I don't know who those are, but maybe that's when they thought, oh, I guess maybe I'll take a 3-month vacation here, or, but yeah.
How long did you know them from the beginning of the process to the end of the process? How long did you know them, and how long were you talking, really quickly?
Yeah.
We knew them all March to August. We were filming.
We didn't know them beforehand. Only Dr. Chang.
We followed 6 to 7 doctors, and a few of those doctors we've known for a long time. But if for whatever reason, the context, whatever they faced, didn't sort of present a full picture of the first surge.
Which happens, right?
Yeah, which happens. So the 3 that we chose, ended up being new. They were new to both of us.
And how long? I guess I'm trying to get the context here, right? Because sometimes we meet folks in certain situations, and in this situation, it was not your typical let's talk, let's shake hands, let's meet. I come down to meet you. We're talking about earlier. Did it feel long? I mean, it probably did feel like you knew them longer. And if you were to say you only knew them for maybe 5 months, did it feel? How much longer did it feel in months? Would you say that you knew?
Oh my gosh, yeah.
Well, time in 2020 and during the pandemic is almost impossible to track.
But I think that's. It feels like, I think what was really special about this relationship with them was that we felt like they were confessing to us, right? Yeah. And there was something so personal about that. And you've talked
almost like priests, right? I mean, I'm not film priests, if you will.
I mean, people do talk about, this is interesting too. I think I brought this up with you too, which is like often and Richard, maybe you relate too, which is that the camera is often a confessional, feels confessional. Like sometimes with when I'm making a film about somebody and they don't open up amongst their families, the minute the camera is there, it's almost, there's this weird thing where they just people feel so comfortable to open up. And I find there's that little, I don't know how to pinpoint that, but there's a sort of an effect that happens, and and it's this, and it is this. I think it is the screen, knowing that you're talking into a void that will reach somebody, and I think there's something about that that's really cool. And that I tried to talk to you about that. It was just so hard to find for me, because usually the camera is the confession. But
for me though, I think my understanding is that everyone always has something to say. It's whether someone will listen or not.
That's it.
And for me, we simply asked, and those who wanted to share their story said yes. And we had conversations with everyone for 20-30 minutes, and then we never talked on the phone again. I just received and said, thank you so much. I saw this. Yeah. I'm so sorry.
What was your sign off? You had a sign off on your emails that was really kind of, maybe it's cheesy now, but
I can't even remember.
It was, anyway, she had a nice,
but I feel like, but get back to your original question. I feel so close with them, but what was funny, so close with them, each of them, I feel like we've known them for years and years, and that they're our very good friends. But then we had our first Q&A a few months ago, and they were like, oh, hey, that's what you look like.
Yeah, it was
and we
weird.
realized
that
they had never seen us, which is
No, I'm joking.
No. So
which is very trusting, but maybe also great because they just were really giving it to,
And Dr. Brady has talked about the fact that she wishes that she could keep recording these diaries because she's felt that they have been very helpful, therapeutic in a way. And something that I've loved that she's talked about in past Q&As is that amongst her ward, they've started a wellness check-in with everyone on Zoom, all the employees, everyone that she works with. And in a way, I feel like it's sort of connected to this idea of the therapy of communication and telling your story.
It brings us back to that great documentary on the General Hospital AIDS ward. Yet we had that AIDS ward, and the nurses and doctors were everywhere in the world, as opposed to just the AIDS wards back in the 80s, which was, the only one I knew because I grew up in San Francisco, was a General Hospital. And it's just that parallel is sobering. Since you've known them this way, and I really have to ask you this, since you know them, what do they say about us?
Oh, that's the civilians.
You mean the everyday us? Yeah.
Yeah.
Surprisingly, there has not been much criticism. If I was them, I kept.
No, I mean, and I mean, Annie, given who they are.
Yeah.
Oh, yes.
How well you know them and what their existence is and what you learned about this tough time of who they are. What do who they are say about us?
Oh, I see.
Oh, gotcha. Yeah. Mm-hmm. What do you think?
That the gut reaction is like something about like trust and putting trust in. I think there is. I don't know. There's something about just stepping into seeing through their points of view. I think you see that in their confessions, that they worry about the decisions and choices they make. Obviously, there are moral, ethical questions that they're confronted with, certainly in a pandemic, certainly when it comes down to, God forbid, moments of triage and such. And you see them grappling with that I think maybe the reflection, is this, is this great need for trust that we have to put into these professionals, and that we are at many times at their mercy. They decide if we're in serious health problems, whether and how to treat us, and I think that the flip side of that is just making sure that we're not, I think people I think I'm leaning over to like where things are with the vaccine right now, for example, that there's a lot, that there is unusually, and I don't know the percentage, maybe the statistic, but I'm under the understanding that there is a need to persuade people that it's important to get vaccinated. Not everyone is on that side yet. And I think when I think about doctors and the frontline workers like that, I think that there is this, there's this need to see, I think there's a need to, for us to see them as necessary and trustworthy. Does that make sense? I have no idea what I'm saying, but
you said a lot. No, and we do need to see them as trustworthy. It's true. Annie, did you want to add something there?
Well, I actually just wanted clarification. Do you mean the royal us, like all of us, everyone civilians, or us as filmmakers and artists? Or
I took it as
the royal us.
The royal us.
All of us. Everybody.
Yeah. What does it say about what is now that we know more about them and what it takes to be a frontline worker in a global pandemic? What does it say about us? In many ways, it's been a call to action. Which is inaction actually at this moment in time, but it again, when you see your everyday struggle in perspective and in relation to somebody else's, it does knit you together, especially at a time like this. It knits you together in the same fight, if you will, however trite that sounds. But I feel like there isn't actually as much a divide as I thought, I guess. We're doing very different work in our day-to-day, but we are all, so cheesy, but we're all really in this together. And it felt like that when I was watching them.
Well, I think, sorry.
Oh yeah, go ahead.
Well, I would say basically that I wish if I had, if I got the virus, that I hope that I was in one of their hands, because I know that they don't judge, they wouldn't judge me. They would try to save me. That's the basic thing. That's all I would want. And, I get emotional. Anyway.
Yeah. Certainly there are heroes among us, as they say. And I think Pandemic19 gives us a slice of how they come to understand that they have become that. And for us as viewers, the royal us sees that it's in many people around us, and that it is uplifting.
Yeah.
Good. I hope we were very careful thinking about how we would end the film. And also we ended it in September, really, when we didn't know even where it would get to. If we look at the numbers now, we couldn't have predicted this, even having tracked the numbers for so many months. And yeah, it's such a dangerous thing to end a pandemic film on a hopeful note. But we also wanted to show all of the incredible things the humanity has done to get us thus far. And then we kept the ticker counting going,
that's
the ticker
the reminder.
counter going, which is
the reminder.
That's actually right. The deeper question here is like, but can we all really do what we need to do to stop this thing? And it's clear that we haven't been able to totally yet, but we're all working on it.
Yeah. I mean, that was the impetus of the film as well, which was that we were hoping that this film would have influence on people who were not really taking it as seriously as other people were taking it. And I'm hoping as the film is rolled out, World Channel, PBS World Channel on February 1st is doing the national release, that I'm hoping that this, people will get to see it and get something out of it. Yeah.
Take it seriously again.
Take it seriously.
Yeah.
If you were to do it again, would you do anything different? And if you would, what would that difference be?
Would we do something different?
I would continue filming.
You keep going.
So we would make the short for the election. And then I think we just did not know it was going to last so long. And we had to make that call pretty early on.
Yeah.
we would have made the short while hopefully the doctors would have kept sending in diaries, because the trajectory of their continued stories has been so interesting. Pooja was let go. She then got a job in telemedicine, which is a really interesting sort of future visioning for healthcare system in America. She's graduating with an MBA from MIT, which she has been in for 2 or 3 years. Mm-hmm. And was hoping even before the pandemic to be part of the change for the healthcare system and industry in America. And now she's more motivated than ever. Ginny, of course, who's really in the heart of things as a critical care pulmonary specialist, has just been riding waves and waves of COVID-19. And Brian, who was a bit nonchalant in the beginning in Northern California, went to New York, got a sobering view there, went back to Northern California, and now they're really in it. So now he belatedly, luckily he went to New York and really got a taste for what it is to be in the middle of a surge that's really taking over hospitals. And now he's in it again in Northern California. So, for me, that's just, I kind of wish we had kept going, because the story is, and it's going to keep going for who knows how long.
I feel you. I definitely feel you as a broadcast journalist.
You might.
We're in there for, a week at a time, maybe. And there's so many compelling people.
Yeah.
And people that are invigorate. Yeah.
Do you feel there's a fatigue around pandemic stories?
Are you fatigued?
I'm not fatigued. No. I think so long as we continue to work hard at digging into what is the story of the day in an earnest and my mentors would always say there's always a story. It is, don't ever come back to me and say, sorry, the lead's dead. That's not, it's not happening, or it's already been told. Well, then what is there are 5 others. So I don't think it is at all, we're not tired of it. It's more of we're tired of the pain of it. And so we can still cover the story, but as both of you know, the arc of the collective viewership we need to follow, right? And be ahead of it and stretch it so that, the purpose of Pandemic19 is to do that, right? So that we think in different ways, and we might act in a way that is better for our society. So let me finish with that then. Is what is that push to society and what we think we are and what we want to be and what we might consider being based on watching Pandemic19?
Yeah, I mean, well, on a very immediate note, I hope everyone sees this and remembers to wear a mask out. And I hope they take their personal daily struggles, which are real. They're real. but I hope they take them again in relativity and remember, just by seeing those doctors and hearing their stories of what's really happening to the folks that are getting sick, and in the hospitals, that they remember that when they, when they're feeling their own everyday struggles, and to listen to the protocols and guidelines in a very simple way. That's what I hope.
Yeah.
And in a greater way, I just hope we all feel connected by this rather than divided, I guess.
I mean, the film ends with that haunting ticker counter into infinity, and I'm hoping, the takeaway for society is to be like, let's stop that echo thing happening with that ticker counter. Let's make those numbers stop. And so, with the new administration, new plans up front, I think there's a distant light there, I think. So hopefully, good things in a few months.
Well, just like we were talking about the 3 doctors that you followed during their journey, parts of their journey, and they decided to stand up and go to work. Again, one of the doctors, Dr. Chang, deciding to get up and go across the country, as so many did across the country. That is a testament to, I think, one of the values that we are taught to embrace. And I think that is invigorating to a lot of viewers when they see what these doctors do to show the vulnerability, but more importantly, that is part of their strength, but also then their fortitude to move and go forward despite all of that. And that was, what I took away from Pandemic-19. And that is, I think, something we all, whether it's a time capsule or not, or whether you get up one day and you need something that's invigorating, it may be a difficult time, but I think it's invigorating. It shows us what we can do despite the most difficult contexts of our decade, of our lifetime, of the century. So thank you, Young Chang. Thank you so much. Annie, Katsura, Rollins, thank you as well. And
Richard.
February 1st, right?
Yeah. World Channel. Yeah.
PBS.
Go see it. I got the sneak peek. I don't want to, which is great. So that's the benefit of being able to hang out with cool directors like these two. And
vice versa, Richard. It's great chatting with you. And
I know it was all the two. I really enjoy how we're able to get into what is important to talk about today. And that's what Pandemic-19 is about. So thank you both.
Thanks.
And I look forward to the next one.
And yeah, thanks. And vice versa, just add that the film you made, Sky Blossoms, is just I think has linkage to our film, and look at caregivers, student caregivers, children taking care of their parents and grandparents. Such a powerful film and a statement to that humanity that we're all seeking right now. So thank you so much.
Thanks for that. Appreciate it. All right. See you next time.
See you next time.